Okay, so this is going to be the simulation of the catheter insertion on the female patient. You're going to always knock before you enter a room and make yourself known, obviously. Hello, my name is Reilly. I'm going to be your nursing student today. Wash your hands when you enter a room and identify your patient with 2 identifiers, so name and date of birth. I'm Susie Q. I was born in August 8th of 1985 or whatever. Make sure that make sure that is the same as the wristband and as your MAR. And make sure they don't have any allergies, especially to latex, because we're going to be putting in the catheter and that could have some latex in it. Okay, so first things first, we got our bedside table here. I have an extra pair of sterile gloves just in case the ones in the kit rip. I don't want to have to leave my sterile field because that negates it and I'd have to start all over. Okay, so as you can see, there's a leg, the female anatomy here. This would be a bed. Of course, in the real world, I'd be standing. The bed would be about waist height, a nice, easy working height. And before leaving the room, always lower the bed back down. The patient should be flat with their legs kind of frogged out. So bend your knees and kind of relax them out so that you have this area to work with and that you can visualize the perineum. Before you start, you want to make sure that it's clean of any soil, anything in the perineum area. You can always delegate that to your UAP. So of course you're going to want to wash your hands. And we're going to go ahead and open up this kit here. Okay, nice and carefully. You only want to touch the outer 1 inch of any of the equipment here. I'm going to save this bag. Always ask your patient if it's okay. But in the real world, I put it where her hip is so I can easily throw anything away here. So we're going to go ahead and put that right there to simulate that. Okay, so then this tells you what we have. A 12 French with a 5 milliliter bubble. There. Keep this if you need a lot of information, but for this purpose, we're going to toss that out. Okay, so now we have our catheter kit here. We always want to open our sterile field away from us first. Of course, only touching the outer 1 inch. We're going to open up our kit here on our bedside table. This is going to be 1 sterile field that we have here. Okay. Okay. So now we're going to take the chuck here, again, only touching the outer 1 inch, and open that up over our sterile field to keep everything sterile. And then you want to put the shiny side down because it's waterproof and use a Matador style to transfer it over to your other sterile field. Don't touch your patient with your fingers because she's not sterile. Okay? Now, you can always have an extra chuck underneath the patient to catch anything that the sterile dressing, this sterile, doesn't touch. Okay, so you don't want to reach over the sterile field once that's down because that is making it not sterile anymore. Okay, so we're going to put our gloves on, being careful again just reiterating, only touch the outer 1 inch. So we're going to open those up. Okay. Okay, so now that we have them open, you want to touch only the inside of the glove with the cuff. So you use that cuff to your advantage, and you want to put your hand on the inside of that glove, making sure that you don't contaminate the outside. Okay, I'm going to show you that again. I can touch anything with this hand now because it is sterile, but what you want to do is you want to make sure that you don't touch any of the outside. Slide your hand in using, again, that cuff to your advantage, putting your fingers in the right holes, of course, and sliding your hand on through. Okay? Very good. Now we can put that aside here. And here is our tray that comes with this. So we're going to go ahead and put that down so that we can have a working space. And since my hand is sterile, I'm just going to go ahead and push that a little closer so that if there is any drainage, that can catch that there. So then I would open up my cleansing swabs, make sure that those are all good to go. Some kits come with the sauce, the iodine or whatever cleaning solution extra, and some swabs, but this one does come with a pack of swabs. And then we have our lubricant, which we can go ahead and so you can just go right over to the trash. Don't touch anything, obviously. And you can squeeze out that lubricant into the tray. This is all sterile. You can throw that away. Okay, and then they have a sterile container for our specimen. We want to loosen that cap just so it's a little easier for you later. We're going to get a sterile specimen here. Then you want to take your catheter out of the box. And since we want a sterile specimen, we want to keep everything sterile here. Okay, so I'm going to put the tip of that catheter just right down into the lubricant there. Make sure that it gets nice and covered. And then that'll kind of keep my catheter, hopefully, you know, it's going to stay there. Okay, and then I'm going to attach my syringe for my bulb here. Take that off and throw that away. And we want to attach that into our bulb connection there on the catheter. Okay, so now that that's all set up, we're going to go ahead and insert that. Now once I touch my patient, that hand isn't sterile anymore. I can't touch that hand to anything else. Okay, so you will have to open up the labia to visualize the urethra. Okay, and then with your other hand you're going to coil up the catheter there. Okay, that's moving around. In real life it wouldn't. Okay, I got ahead of myself here. We're going to want to clean our female here. So we're going to want to take one of our swabs and go ahead and go on one side of that inner labia minora. And then your second swab on the other side, the labia minora. And then the third swab is going to go right down the center. You look for that wink so you can visualize right there is our urethra. Okay, and then just go ahead and toss that out. Now, you can coil up that catheter. Okay? And you're going to want to have the woman bear down. Okay, go ahead and bear down. That way we can open up that path here. Okay, bear down for me. Very good. And then you just guide that catheter in there. Very good. Keep breathing until you can visualize some urine. Okay? Alright, there's some urine flow. So then I'm going to grab the catheter with my hand, making sure that I stay away from that urethra. Okay? Then I can use this hand to instill 5 milliliters. This is a 10 milliliter syringe, so I'm going to go ahead and instill 5 milliliters into that bulb in her bladder. Okay. Very good. And then I'm going to go ahead and give that a little tug, and that's in there beautifully. So then I'm going to go ahead and release it, take off my syringe here, and I can go ahead and throw that away. Now we're going to get a sterile specimen. This hand is dirty, so we just have to keep that in mind when we're going to get this sterile specimen. Okay. Then we have our sterile cup. We put our urine into the cup. Close that lid. Okay, very good. Now, I can take my gloves off, wash my hands, and clean everything up. I'm going to throw all of these things away here. I'm going to label this, document whatever I've gotten. You know, let's say 50 cc's of clear yellow fluid with no odor. We're gonna name and date that, put our name on it, and send it down to the lab. We're gonna stat lock our catheter to our patient's leg and hang the bag down on below the bladder, and then clean up the rest of this. Put back on, you know, whatever underwear they might be wearing, cover them with a blanket, put the bed down to the lowest position, make sure that they have the call lights, and you are good to go. So let's say that you came back and you notice that there's not a lot of fluid in the bag, and it's been several hours. You should have more output than what you have in this bag. So with the doctor's order, we're gonna irrigate our catheter. Excuse me, no tumbling around here. All right, that's not gonna work for me. What are we doing here? Catheter. Jesus. Okay. So you've noticed there's not a lot of urine in the bag. First thing you're going to check is make sure that there's no kinks in the tubing. So it looks like there's no kinks in our tubing. We're going to wash our hands, and we're going to look at the doctor's order to see what kind of thing we can do. We can go ahead and flush our catheter here. So, of course, wash your hands. We're going to put gloves on, And then we're going to use sterile water, and the order says we're going to put 15 cc's into that bladder. Okay, so I drew up 15 cc's, and we're going to put that into our port on the side of our catheter here. Push that in there. And then, as you might notice, it is connected to both ways, so you will kind of have to use gravity to your advantage in order to make sure you're pushing it towards the body and not into the bag. Okay, so you're gonna gently, and if you got a little force, maybe a little bit of pressure. Of course, if they say ow, or if they're, you know, something, it's really not moving, you're gonna wanna stop. But sometimes there's a clot or some tissue that's occluding the catheter, so you might have to use a little bit of pressure to push that fluid through. Okay, of course I'm wearing gloves, I've washed my hands, so now we're gonna make sure that the urine flows back through the bag. Oh, your urine's flowing back through the bag. You're gonna feel much better shortly. You want to check for bladder distension as well in these cases, because maybe it is the fact that your patient didn't urinate or hasn't made any urine. Then the bladder's not going to be distended. But if it is distended, chances are there is something occluding that catheter and you need to flush it out. Okay? So it's been several days now, and the doctor has ordered to discontinue this Foley catheter here. So hooray, hooray. Okay, so we are going to wash our hands. We're going to put on gloves. And we're going to attach to our balloon port here. And a lot of times the syringe will start to fill up on its own here, and you want to make sure you pull out that 5 cc's that you pulled out initially. Okay, so now that that's taken out, you can tell the female again to bear down and gently, quickly but not too quickly, pull the catheter out while kind of coiling it up. And at the end, you want to make sure you visualize the tip and make sure it is intact, that you didn't leave anything in the bladder or the urinary tract. And then you can toss it away per your facility's policy. Of course, again, you want to lower the bed to the lowest position, give your patient the call light. Before every step of this procedure, you want to identify your patient, make sure they don't have any allergies, make sure they're not in any pain. And wash your hands, wash your hands, wash your hands.